Focus. Ideate. Innovate. Enable.
There's been a lot of progress in our country in the last 10 years. New and new hospitals have come up, more doctors have joined the profession, and more technology is also available today. But the fundamental problem remains the same: doctor to patient ratio, patient to bed ratio. So can technology make healthcare affordable, available and accessible?
In terms of solving the problem, obviously technology can be a game changer. And I think, like in every other industry, I think the fundamental structure of the industry, we believe, will get changed because of technology.
Has technology or AI helped the insurance sector to penetrate in this country?
So what we are seeing is over the, I would say maybe year and a half, we think some of the companies are working on adoption of AI. At least what we can speak is for ourselves, where we've used some AI tools, particularly in the area of sourcing. So to give you a couple of examples, using NLP in chat, and AI to develop chatbots. We've done work on what we have a initiative called Myra, where we allow our agents to issue policies without any underwriting. The underwriter doesn't even get into and these are complex property insurance, where usually you have a lot of back and forth, because each of the policies are customized for a specific factory.
Okay.
Now, that is entirely automated through an AI engine. We've done some work on claims adjudication. So the first stage in terms of go no go, is an area where we are seeing very high success rates. We are still running parallel. I think what Dr. Kraft also said, that in terms of this does not mean that you'll eliminate the experts who are doing it. Right now we are at a stage where in certain areas with an expert input, we are seeing better results than just pure AI. But we are seeing, together we are getting better results. So there's a lot of early starts. I think
I recently read elsewhere that some of the insurance company are trying to assess the health of the family and the individual through AI, and ensuring that pre-policy test is not done. Is it happening across the industry?
I've not seen that, in India as yet. On the medical side, on term insurance,
on medical claim side,
I'm not seeing that as yet.
Okay.
I think it'll go in that direction, because what we will get. So start with data. Start with, we talked about EHR. If there were an EHR, we had access with permission from the patients in terms of medical records. We wouldn't need to do a medical underwriting. It's automatically done. There could be social analytics information from the social media through which we could get further insights. I don't think we are there in terms of that data, the base data as yet, but it's a matter of time. I think most of us are working on how to eliminate some of these processes so that it makes it easier for customers and makes it more productive for us.
I can get insurance online today, whether it's for auto or for travel insurance. So technology plays a role here. So has technology brought the cost for the end customers down?
So, let me give you an extreme example. And I don't think you'll find such numbers anywhere in the world. If you look at the lowest cost insurance that we provide, it's for, the accidents in railways. You buy a railway ticket. If unfortunately during your trip there's an accident, we pay, 10 lakh rupees. The cost of that cover is less than 1 rupee. That's where it's gone down. It's into paisas, and it still works because it's completely digitized. The process is completely digitized, and because of the large numbers, the law of large number kicks in, and it becomes viable. So we've seen similar very low cost solutions. So we talked about Uberization of healthcare, but if you look at what we do with Uber, is very small ticket accident insurance for their drivers. What we're finding on the health insurance side is that you have to think about designing a product that meets the customer needs, is cheap, easy to underwrite, as also easy to claim. That's the only way it will work. So we've done that. We've done, we've got new product going for the last about a year, where we pay a standard lump sum amount, whatever may be the treatment, per day. So you can buy a product which will pay you for 30 days, 1,000 rupees per day. The cost is minimal, it's in hundreds of rupees. We are selling, huge numbers every month. We almost reached 1 million policies in less than 1 year. So the answer to your question is yes.
Okay.
There is clear evidence that this is the way to go.
So across the sector, are we seeing any emerging trend where technology adoption is very, very high across the sector?
I think, what we call sachet pricing of insurance for small episodes, small duration covers, individual, disease-specific covers, low-cost covers like the one that I talked about, we believe is the way to go. That's the way to design
But
insurance.
has the penetration happening?
Of course. I can tell you that for us, if you look at...
And I'm saying for the whole industry as a whole. What was it 5 years back and what is it now today?
Look, all of these policies are small ticket. So in terms of GWP may be small, but in terms of number of customers that are coming into the fold, they're huge. And this is just a journey just started. I think this digital ecosystem play, as we call it, is probably maybe two years old, not older than that.
So you want to add? Sorry.
Where this sort of blends worlds, we know in the financial world, if you're going to get a loan to buy a house or a car, you look at your financial health, a FICO score we call it in the United States. What's interesting now, it's happening in the US and even here in India, is you can start to score someone's driving and track that on their smartphone. If they're a bad driver and keep speeding or having accidents, you'll increase their rate. You can track that their health of their driving. Now, it's a bit big brother. We can track the sort of driving of an individual's health. Are they going to the gym? Are they doing their meditation? Are they doing yoga? Did they quit smoking? And if they are changing their behaviors into a healthier score, give them a better or lower premium. So that's part of this redesign that uses technology and uses AI and uses scoring to hopefully align incentives and meet the individual where their incentives might be, whether economically or through social badges or other kind of social engineering.
In fact, just to add to what Dr. Kraft just said, we just launched the first wellness index for the country, where we've kind of looked at some of these parameters in terms of what customers, how customers look at wellness, what are their perception versus what are the actions that they're taking. And we've done it for 11 cities. So we've got city-specific wellness indices as also a national index. It's a start. We'll see how granular we can, take it.
What did it throw up? Anything?
Lots of interesting things. So, for example,
are South more healthy or North more healthy?
It's not about healthy. It's about the wellness of a perception of wellness. And some of the things that is coming through is in the mind of the Indian customer. Wellness is not just about physical health. It's not just about fitness and diet. It's also about mental and spiritual health, which is quite interesting because you would kind of expect it in the Indian consumer, but it was a hypothesis. The fact that it's coming out with data is interesting for us. What's also interesting is understanding versus action. There are certain cities where the level of understanding is very high, but the level of action is low. Could be because of attitudes, could be because of infrastructure. So it's interesting, I think, and the direction has to be the one that we discussed in terms of using some of these elements to incentivize people towards healthier behavior rather than just pay for sickness.
Approximately 5 lakh Indians die due to non-availability of organs every year in this country. 3D printing is said to be the solution for this. We have a lot of startup working on this, but it is not making it commercially viable. So what needs to be done to make it commercially viable?
So 3D printing is one of those, not new technologies, but ones that are advancing very quickly now. And you can do some interesting things. This is actually a 3D printed ratchet that was printed on the International Space Station. Now you can send a file to the space station and print a ratchet. Okay? This one wasn't actually up there, but you can print physical objects. You can scan me with a smartphone and print me. This is a little mini version of me. Now that's a long way from printing a kidney or an organ.
Like a magician pulling rabbits out of your...
But I'm actually a stem cell biologist and bone marrow transplant biologist. And what's interesting now is we can think about, instead of printing plastic, printing stem cells or progenitors. And there's a lot of maybe interest about printing a kidney or a liver. That's been successful a little bit in small versions, which can be used to screen for drugs. So I could take a skin scale from you, turn it into a stem cell, grow a micro liver, and study how your liver responds to drugs. That's where it's being used today. It's another level to grow one that can plug into your blood supply. I think before we get 3D printed organs, there's going to be something more disruptive. There's this new ability to engineer genetics, a technology called CRISPR-Cas9. It's only 5 or 6 years old. So now we can genetically engineer pigs, human-sized pigs, to knock in some human genes and knock out some pig genes and humanize pigs so that that organ is human sized, comes from a humanized pig. It may not be kosher, is the joke,
Okay.
but given the huge shortage, it's going to be faster, cheaper, and safer than probably trying to 3D print a complex organ. We have printed tracheas, bladders, very simple organs, and those have had transplants to date. But given the huge unmet need for organs like kidneys, livers, hearts, I think we'll see the advent of humanized organs coming from pigs that are genetically engineered before we get fully functional 3D printed organs that can be transplanted.
Okay, Bhargav, at India also we see a lot of innovation happening. It could be frugal. And I was reading a report of innovation by entrepreneurs who develop a machine that can do breast cancer test for 65 rupees per scan, ECG test for 5 rupees each, and dengue diagnosis for 140 per test. The question I want to ask you is, how can we make this commercially viable?
So, again, we could wait for the government to set up something and, encourage this. Our belief is that, we need to think of encouraging and allowing them to develop without any necessary government fiscal support. So one of the things that we are doing, as a large company is we have, like most large companies, pretty, interesting accelerator program where we work with some of these startups. And some of the very interesting solutions that we've seen, from some of these startups is being incorporated in some of the solutions that we providing to our customers. So just to give you a couple of examples, one of the initiatives that we're piloting, and it's a pilot that we're running with one of the Bombay-based startups, is to provide for people with high blood sugar an AI-driven coach to help them maintain their diet, fitness, as also overall lifestyle, so that their HbA1c comes down within range. And there's nudges, behavioral science, incentives, blended in there. Yeah. And this is something that is something that has come out of the startup ecosystem. We are working with one of the startups on providing health checkups in 15 to 20 minutes at the office premise. It's a pod where you sit. There are some simple pinprick and everything is there. It's done in 15-20 minutes. It's
accuracy.
It's FDA approved solution. Interestingly, so it's high quality, low cost at your home, and in fact they've got a backpack solution with which they can go to your home and do it. At this stage, these elements of physical intervention is still needed. Maybe even that will disappear very soon. But these are solutions that are already there. And I think as large organizations, we find them very, very effective in terms of partnering, because some of these things we wouldn't have done. It's beyond our area of focus, for example. But these are solutions which are very useful for our customers. So there is a way of working together with and partnering with these players. Some of them will work, some of them won't work. But that's the nature of the beast.
What kind of efforts are needed to have a specialized domain research in medical field like robotic-led remote surgeries? And how can India foster a culture of research and excellence?
Well, part of a culture in that accelerating future is not to think about silos in healthcare, not just roboticists, not just biotech or pharma, but putting them together, often converging technologies. So where robotics meets AI is getting interesting. So now when you're the robotic surgeon, you see through the camera and there's AI guidance to maybe let a more junior surgeon do the job of a master surgeon. There's the ability to have a big data scientist who might have been building video games or economic financial engines learn to manipulate and play with insurance data and be able to predict who's getting sick early. So I think part of fostering new solutions that will be integrated and successful is having people blend and get the patient involved. There's often they think, well, we're going to invent it in a silo. You need to have patients included, nurses, caregivers, understanding when you send someone home to try and lose weight, it depends what is their family eating. How can you use new voice technologies like Alexa or Amazon Alexa to listen and even provide you medical help? Alexa, help, I've fallen, I can't get up. Or Alexa, how much insulin do I take based on the donut I should not have just eaten? So it's a bit of that blend. And part of my role at Exponential Medicine is pulling people together and bringing folks from India, Europe, Latin America together to to cross-fertilize. You don't need to invent everything in Silicon Valley, where I come from. Many inventions and innovations that are developed here will leapfrog and come back. So there's amazing markets, obviously, in India and Asia that can come over to the western side of the world. But I would argue that anyone who's trying to innovate in healthcare has to be a team player and not think in just any one technology bucket. It's that convergence where things get interesting, and particularly where technology will be in just a couple of years. You know, robots you can swallow, artificial intelligence that will live on your smart ring and track. This one tracks my sleep and gives me a sleep score. The rapid emergence of augmented reality, so a surgeon can see the MRI data blended with their surgical ability. Or use that to educate surgeons. I was in London with an Indian-trained physician. They did the first VR stream surgery. That surgery was watched by 5,000 medical students around the world, so we can democratize medical education. So lots of opportunities, and to be a leader, I think it means being a little ahead of the game and pulling people together while understanding in depth the unmet need and partnering with the folks who really have the incentives, who pays for the care. Because you can have a great new startup, if it's not paid for at some level, it blows up.
India is striving to achieve the United Nations Sustainable Development Goal of providing universal healthcare by 2030. But for that to happen, we need to put a lot of things in place. One is to make patient data available, reduce frauds and insurance claims, stop spurious drugs, and make everybody in the value chain accountable. Do you think this is doable?
So if you look at our rank currently, if I remember the number, I think we rank 128, as a nation in terms of, in terms of our proximity to achieve the 2030 goals. So we really have to buck up. There is no doubt about that. And some of the factors that are pulling us down is air quality, sanitation, malnutrition of children, child waste, and hepatitis B, which needs vaccination. So there are some very obvious items that are being attacked, no doubt about that. I think on sanitation, whatever maybe your political inclination, the entire Swachh Bharat mission is a very, very positive development. If you look at what can be done on vaccination, I think we've done that in the past with polio. Clearly we can do something more there. But we need to go on a war footing. So when you talk about spurious drugs, I think the estimates are that the roughly 20% of drugs in India are spurious drugs. Now, coming to technology, you can build a blockchain solution tracking the drug from the manufacturer, location down to the final buyer. And in fact, if I remember correctly, Niti Aayog had proposed something like that. I don't know where it is in terms of implementation. So we need to move on a war footing on some of these areas. We need to work on accountability. We talked about what is happening to hospitals. The unfortunate incident in Delhi. You charge 16 lakhs for a dengue case where the poor girl died. And you used, if I remember, some 7,000 surgical gloves, 500 syringes or some such number. Just quite ridiculous. I think there is a lot of work that needs to be done on accountability. So there are a lot of areas that needs to be worked upon, and we need to do it on a war footing. Otherwise, to me, at this stage, it looks difficult for us to get there.
So to sum it up, we need to do everything on a war footing, and technology is the way forward.
Maybe war is the wrong perspective, but I would think it becomes for every Indian citizen and technologist to be proactive, to even take ancient technologies. Today was yoga day here, or mindfulness training. You can take technologies like brain-computer interfaces and help you meditate. But those are simple skills to stay healthy, happy, well early. And you don't need to go to war if you're sort of living in peacetime, and use these technologies in smart ways. So it's an imperative for everybody to think that they can help create the future of health and medicine. It's not just for the insurance companies, the doctors and nurses. It's a really amazing new entrepreneurial and personal era for the future of healthcare.
Dr. Kraft, you seem to have the solution for all our problems. Technology is the way forward. Thanks a lot for being on the show. Thanks, Bhargav.
Thank you.
Thank you.
Focus. Ideate. Innovate. Enable.